Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina at Hickory Spine, and today I want to talk to you about how do you treat scoliosis. And so this question really depends upon the cause of the scoliosis and the degree of scoliosis. And when I say degree, I mean quite literally the how many degrees does the curve in the spine measure. So, typically what we'll see with scoliosis is that there are three different degrees or grades of scoliosis. The first grade is a scoliosis that is between 0 to 20 degrees. And how do they come up with the degrees is how we determine the degree of the curve is we take an x-ray, and then we can take that x-ray and we can literally measure in degrees how big that curve is. So the scoliosis itself is broken into three different grades: 0 to 20 degrees, 20 degrees to 40 degrees, and then above 40 degrees. So a scoliosis that is 0 to 20 degrees is treated if at all. Sometimes it doesn't require treatment. If it's painful, if it's causing spasm, if you're worried about degeneration of the spine due to that curve, because the curve, listen, when you have a curve in the spine, it does cause loading on one side of the spine more than the other. It causes muscles on one side of the spine to contract more than the other. So if you want to work on decreasing pain, improving function, and helping the scoliosis to try to preserve it so it doesn't get worse, then some of the things that we do in our practice can be very beneficial. Now, if it's 20 to 40 degrees, it's a much greater curve, then bracing is almost always recommended. So a specialized bracing that pulls and can help to improve the curve of the spine. And there's a special company that you want to use for that, and I will record a separate video in my video education series, which can be found on my website, along with this video, to help you. And I'll research that and be able to tell you, because I don't remember right off the top of my head the name of the company. But 20 to 40 degrees, you brace it, and you do corrective exercises, and you can utilize other therapeutic approaches like chiropractic adjustments, which can be beneficial. Now, beyond that, over 40 degrees, anytime it's over 40 degrees, you've really got to consider consulting with a spinal surgeon. And no one wants to have rods put in their back to straighten it. But what you really run into is if bracing, and even the best bracing, if it cannot fix and at least improve the curve so it's not over 40 degrees or compressing organs, then you've got to look at and possibly consider surgery. Because over 40 degrees, what occurs is that you can have loss of lung volume, you can have compression of vital organs like the heart. It can create a lot of issues. So you've got to weigh those things out, and that's really important to do. So there's a lot of different factors to consider, but it really depends on the degree of your scoliosis. Now, there are degenerative types of scoliosis that tends to happen later in life as the spine can become unstable, just due to wear and tear or even traumas that have occurred, and those all have to be looked at on an individual basis, because as you get older, you get to a point where you're no longer a candidate for surgical intervention, and even if you have a scoliosis, you may be able to do, and very commonly we work with people that are older, that have problems with the spine and with arthritis and degeneration, to help them decrease pain and improve their function. Now, it may not be something that we're going to fix, but you know what? If we can help them avoid powerful pain medications, lots of injections and surgeries, then it's definitely worth doing something to try and maintain their function naturally, right? So we help a lot of people do that, and depending on the degree of degeneration of the spine and the condition of the spine, will help you determine what type of approach or therapeutic approach is appropriate, or surgical intervention may be more appropriate. So it just really depends on the person and their problem. If you have any questions about scoliosis, then just reach out to us, let us know. If you'd like my opinion on your case, then I may be able to help. Just give us a call. Our phone number is 828-324-0800. You can also learn more about my clinic at hickoryspine.com. And I hope this has helped you better understand scoliosis, and I hope you have a great day. Thanks.